Is infertility a women's problem? It is a commonly held belief that women are responsible for the infertility. Among the couples suffering from infertility, it is seen that 30% of them is because of the male factor, 30% due to the female factor, and rest are both are involved, and there is a group of unexplained infertility. And because of the sensitivity of this issue, this infertility problem has never been discussed as a political or healthcare professionals or the media don't discuss it because of the sensitivity of the issue. A nourishing diet, a moderate exercise, and a stress-free life is important to conceive. Being underweight or overweight can affect fertility, and it is important to keep a check on the weight as well as the diet to achieve a result. One in 5 couples with infertility suffer from what is called as an unexplained infertility. It is a very frustrating issue because all the tests which is being done comes out as normal, and there is no particular reason for this called as unexplained infertility. So the good news is that it can be treated, and the best thing is to contact the infertility or the IVF specialist who can help you with this unexplained infertility. When a couple suffering from infertility, there's a common advice from well-meaning relatives, just relax, you will conceive. But this is a wrong notion. Just relaxing doesn't help in conceiving. It is seen that 90% of them have a medical disorder, and it is not a stress-related disease which is responsible for the infertility. It is a myth. It is a known fact that along with the age, the fertility reduces. But it doesn't mean that being young ensures fertility. We have people or couple in young age who come with infertility, and paradoxically, we have patients at 40 years conceiving naturally and delivering a healthy baby. No, it is a completely false belief. We cannot blame the women exclusively for the infertility problem. We have seen that most of the problems lie in the men in the form of sperm count or the motility. And we cannot blame only the women for the cause of infertility. While infertility is caused because of the bad lifestyle factors, thankfully it is reversible. When back in a right track with a healthy diet and treatment, your fertility is restored. When you are facing an infertility problem, it is very important that the couples should support each other. And it is a fact that the parents' interference in the treatment process can lead to a lot of arguments. But evaluation is the best method to select the mode of treatment and whom to approach. And it may be difficult for you to deal with friends who have got kids or friends who are in the process of having kids. So there is a lot of emotional support which is needed by the couple. With a little planning ahead, you can ensure that it does not affect your career. You might have to go in for early appointments or go in for a sudden appointments. With a little planning ahead of your schedule and work, and with the help of your colleagues, this can be well arranged without interfering with your career. It is a very sad belief that many have. Most of the people blame the sins of the previous birth or the curse of the god which is responsible for the infertility. But the fact is, all the cases of infertility can be treated with the latest development of technology. It is normal to feel stressed out, depressed, and emotionally upset about the whole treatment of infertility. Please don't allow it to upset you or put you down. There will be a lot of pressure from the society and from the family, and the pressure from the relatives. There is a way of treatment of infertility, and approaching the correct infertility specialist will allow you to overcome the stress and the emotions and lead you into the correct treatment pathway. On hearing about their infertility, the couples feel working hard will achieve them to conceive easily. They will pore over a lot of magazines and books trying to find out what is happening to them. Yes, it is good. They do understand what is the cause of infertility, but that will not help them to conceive. A proper guided treatment by an infertility specialist will achieve them to reach the result. Lean on pillars of support like your family and friends and share your feelings. This will de-stress you. Slow down your work pace and try to de-stress yourself by including yoga, meditation, and exercises. This will improve the fertility. This is a personal choice, though you might have to take your boss into confidence so that he or she is supportive to the treatment. You might have to visit the hospital or take a few days off for the treatment, and having the boss in the loop is helpful. And relieving it to your colleagues is an optional choice, but the treatment is not going to interfere in your work. If you allow it to, it can. Even the most sexually active couple feel desensitized and they do not enjoy the family life. So be creative in the family life and don't think that being together is the only method of getting a baby, rather than enjoying the family life. It is a personal and sensitive issue, and infertility is something you need not feel ashamed of. It is commoner than you think. 1 in 6 couples suffer from infertility. You need not hide it. Kindly discuss with your family and friends. Strictly speaking, you have to wait for 1 year of unprotected intercourse to achieve a conception. But in certain cases, you will have to consult an infertility specialist for earlier diagnosis and treatment in cases where the lady is obese, irregular periods, endometriosis, myoma, and in men who are obese, chronic smoking, or have got any injury to the genital areas. No, this is wrong. In the women, few tests for tubal evaluation, uterus, and the ovulation, and semen analysis for the men can be done with less expense, and all can be completed within 1 month. This is wrong. In most of the cases, we find that the male factor plays a very important role in infertility, like low sperm counts and motility. The earlier the diagnosis, we are able to help in better treatment. So kindly consult an infertility specialist for evaluation and management. This is a complete misnomer. There are different types of infertility treatments which are available. Based on your history and diagnosis, the treatment is optimized according to your needs, and the cost also depends upon the treatment, and proper guidance will help you achieve the good result without expenses. No, most of the treatments involve a few visits which are very short and would not require long treatment at the hospitals, and it will not interfere with your daily work. This depends upon the mode of treatment. The risk of multiple pregnancies is low in centers specializing in infertility treatment, and they make sure that the health of the mother and the child is not jeopardized by this multiple pregnancies, and they take care of it. This of course depends upon which hospital you are heading to. And ideally, you should be able to get an appointment with the infertility specialist within a month. This is a misconception. Age plays a very important role in women's fertility. It is said that after 35 years, the fertility declines and pregnancies are less after 40 years and very rare after 42 years. And celebrities who conceive after 40 years mostly are by IVF method. Men who don't have sperms in the ejaculate, a condition called as azoospermia, can still father a child if there are sperms in the testicles. And women with no ovaries or the uterus can still have a child through third-party reproduction. This is a completely wrong idea. Though smoking can interfere with the fertility, you cannot stop your biological clock. The fertility reduces from 35 years and drops to almost nil at 40 years. So just because IVF is available, it does not guarantee a pregnancy at later age. No, even if you lead a healthy lifestyle, eat plenty of vegetables, fruits and diet and maintain your weight, you can still have an infertility problem. Having one child is no guarantee that they will be able to conceive again. Some couple have got a problem called as secondary infertility, where they take a long time to conceive or the treatment to be given to achieve a pregnancy. Definitely not. However, couples who have overcome infertility and had a child are likely to appreciate the bundle of joy better. That's because of the extra effort that they have put in. It's not about just going on with the treatment. With regular treatment schedules, results of conception is seen in most of the cases. But there are a few which becomes impossible. In those cases, if the doctor says to stop treatment, it is better to stop treatment and look out for alternatives like adoption.
how do lifestyle affect the reproductive function? Lifestyle factors include age, weight, diet, smoking, exercise, psychological stress, caffeine consumption, alcohol consumption, and exposure to environmental pollution. All these will affect the reproductive outcome of the couple. Now, if you see, because of the present lifestyle, the hectic lifestyle, and most of the IT professionals who work round the clock or in the more of night duty shifts, there is a lot of hormonal disturbances and irregularity in the diet consumption. So all this will cause an erratic food habits, as well as there is a lack of sleep, which causes a certain amount of hormonal disturbances both in the male and the female. Now, how do these hormonal disturbances affect the reproductive function? Is there is a complete disharmony in the hormones. Why do we give so much of importance to the lifestyle? Everybody keeps talking about the lifestyle. Yes, there is a little amount of importance because there is a lack of time for the IT professional and the BPO and many other professionals. So all this causes a lack of time to prepare food, so they don't eat properly, junk food, eating high caloric food. All this will affect the body weight. So there is an increase in the body weight. Once the body weight increases, the hormones gets disturbed. Once the hormone gets disturbed, then the fertility potential of the couple starts coming down. So what do you mean? Everybody keeps telling, what do you mean eat a healthy diet? It is not easy to eat a healthy diet in our hectic life, but at least the composition of the food and the caloric value of the food should be a little perfect to maintain a healthy diet. So this healthy diet is very important to put all the hormones under control. Now, there is a wrong notion if you are very obese, that is, if your weight is very high, you don't conceive. It is wrong. Now, there must be a certain amount of an effort taken by the couple, both it can be the male or it can be the female, trying to put down the weight, which will improve the fertility. In the recent times, we have found a surge in the secondary infertility. What is secondary infertility? The first pregnancy can be an IVF or it can be a natural pregnancy. With the second pregnancy, if you see, they try very hard to get the pregnancy. Why? Because of the hectic lifestyle, the lack of cohabitation, and there is a decrease in the sperm count or there is an increase in the weight. All these contribute to the secondary infertility. So they are having difficulty in getting the second baby. And we have one category of patients where they have children, they have undergone sterilization, and now one of the child dies, and then the patient comes back for recanalization of the tubes, in which sometimes recanalization is not possible. In those cases, we say please go for the higher procedures like test tube baby. So is it compulsory that if the first baby is an IVF, you should go for the next test tube baby? In many cases, we have seen people conceiving naturally after an normal IVF pregnancy. Normal pregnancies are demonstrated even after a complete tubal block. So the reason attributed, we cannot explain. So it is not compulsory that the first IVF pregnancy, the second pregnancy also should be an IVF. In many cases, in the first pregnancy can be normal, but second pregnancy, there are certain factors which makes us go towards IVF for that particular couple, and that is, I think I would attribute all that to the environmental changes, the sperm count changes, and the increase in the body weight, which forces us to make the patient undergo an IVF for the second pregnancy when they have a normal first pregnancy. Everybody is talking about stress causing infertility. I would not go by that. Stress does not cause infertility. It is an infertility which causes a lot of stress on the couple and affects the work situation, the relationship with the spouse, and the family relation. There are a lot of inquiries about whether acupuncture can be done and the IVF to improve the results. In Western countries, acupuncture has been done after embryo transfers. Now, scientifically, it was thought that when they do acupuncture, there's a lot of hormones, reproductive hormones, which are released, and there's an increased blood flow to the uterus and the ovaries. So, when the blood flow improves, then when we do the embryo transfer, it is supposed to improve the pregnancy rates. But there has been a mixed reviews for this acupuncture. In India, it has not yet come into force, but maybe after a few years when acupuncture really seems to be helpful, maybe we can introduce it in Indian practice also. The patients which we see, all patients are not in an allopathic treatment. Some of them are in Siddha or homeopathy for some chronic diseases like chronic sinusitis or hypertension or diabetes. So they all come and ask us, Madam, see, we are in alternative treatment. Can we undergo IVF? There is no problem in them undergoing IVF provided the Siddha and the homeopathy clearance has been given, because the drugs which are used we do not know. So if they give us clearance, then going to IVF is not a problem. Now let's talk about the food habits during the IVF process. There is nothing special about the food habits. Please follow your regular diet and see that you don't take high caloric food, because you have a tendency to put on weight, because during the IVF process there is a limitation in your mobility and the exercise regime. So please go in for a normal diet. The only precautions you should be is please don't eat outside, because that if you have diarrhea, we are in trouble. What is the risk of multiple pregnancies and IVF? So everybody is scared. Okay, when you go to IVF, you get twins, triplets, and a lot of complications. Yes, 20 to 30% of the IVF pregnancies have multiple pregnancies. That is because in the older days, a day 3 embryo transfer was done, where more embryos were put inside the uterus. But now, with modern techniques, we take the embryos to day 5, where a blastocyst formation is demonstrated and a single embryo is transplanted. So by doing a single embryo transplantation, what happens? The single pregnancy chances are more. Now, if there is multiple pregnancies, the complications of multiple pregnancies will cause a lot of problem to the patients. So with the SET, single embryo transfer, the world is changing. A patient undergoes IVF and the IVF doesn't work. So what to do next? Because they are emotionally and psychologically upset. So the reason why the IVF has not worked is analyzed, and if we are able to find out a particular reason which can be corrected, a second IVF is suggested. But IVF has got a limitation. You cannot keep doing IVF for long. When the number of eggs are less, or when the uterus is badly damaged, or the sperm count is absolutely poor, we offer other products like, please go for donor egg or a donor sperm or surrogacy, or go in for adoption. There is a limit to the treatment in which IVF says, yes, this is the end of the treatment. The worldwide success rate in IVF is only 30 to 35%. The success in IVF is based on many factors, and a proper counseling to the patient is very important. The age of the patient, the weight of the patient, and what was the reason why the IVF was done, and the number of follicles that the patients developed, the quality of oocytes, the quality of embryos, and what was the lining of the uterus, what was the quality, is it good? All this determines the success rate of the IVF. Some couples have a wrong notion. Okay, I go to IVF, it is not a natural process, how will our baby be? Is it a normal baby or is it going to have some problems? The IVF is a natural process. We are just putting the sperm into the egg. We are not interfering with your genetic material. And a long time follow-up of many of the IVF babies have showed that none of the babies have got major congenital anomalies. So it is a safe process, and please leave the apprehension that you will get abnormal babies. In the current scenario, we see a lot of diabetic patients. Both the husband is diabetic and the wife is diabetic. Will diabetes interfere with infertility? No. It is not necessary that these diabetic people will have infertility. As long as the sugar levels of the lady is under control, the embryos will progress perfectly well. But if you take the male, when the sugar levels are very high, the sperms are affected. When the sperms are affected, the DNA inside the sperm is affected, and that might cause abortions in the early pregnancy stage. So that is why we say please keep your sugars under control. Diabetes in per se will not cause infertility, but it will cause early pregnancy problems.
Hi friends, myself Rajkumar, 39 years of age.
I'm Anita Rajkumar.
It was a love marriage, like I got her married. My wife, my job and everything was going very smooth.
11 years I've been taking treatment for my infertility.
என்னோட wife fertility issuesல எங்களுக்கு problem வந்திருந்தது.
Basically I'm a PCOD patient, cause of which I'm not getting pregnant or I'm not able to conceive.
மொத்தம் ஒரு 5 ஹாஸ்பிட்டல் நாங்கள் போயிருக்கோம். அந்த 5 ஹாஸ்பிட்டலையும் வந்து நார்மல் ஹாஸ்பிட்டல் கூட சொல்ல முடியாது. இட்ஸ் a very reputed hospitals as far as the fertility things are concerned. எவ்வளோ ட்ரீட்மெண்ட் எடுத்து பார்த்தும் கிளிக் ஆகாமல் இருந்தது.
Lot of medicines went into my body. Initially I started with pills, then it went to injections, then I underwent laparoscopic procedures for 2 times in fact, then I underwent IUI for close to 4 times in fact, so nothing clicked in.
4th year 5th yearலாம் வரும்போது குழந்தை இல்லை அப்படிங்கிறது வந்து அந்த சுச்சுவேஷன் நினச்சி பார்க்கும்போது மை ஒய்ஃப் வாஸ் ஆல்சோ வெரி மச் டிமோட்டிவேட்டட். என்ன பண்ணலாம் இந்த மாதிரி சுச்சுவேஷனில் அப்படிங்கிற மாதிரி இருந்தது. ஸோ அவங்கள நான் கன்சோல் பண்ணுறதே எனக்கு ரொம்ப பெரிய சேலஞ்ச் இருந்தது.
Dr. Rajni has suggested me taking up IUI.
We believe that this lady doctor can make some difference and this hospital can do something for us. அப்படிங்கிற ஒரு ஆஸ்பெக்டில் we started the treatment.
I love the way my time was saved in fact. I entered there and the way doctor received me immediately and the way doctor herself has scanned.
ட்ரீட் பண்ணுற டாக்டர்ஸ் வந்து அவங்களுடைய அட்டென்ஷன் எங்ககிட்ட நாங்கள் நிறைய எதிர்பார்ப்போம். அப்படி இருக்கிற அந்த சுச்சுவேஷனில் வந்து ஒரு பர்சனல் இன்ட்ரெஸ்ட் எடுத்து எங்கள் கேஸை ஸ்டடி பண்ணோம் நாங்கள் விரும்பினோம். அந்த பர்டிகுலர் ஆஸ்பெக்ட் வந்து எங்களுக்கு டாக்டர் ரஜினி அண்ட் ஃப்ரம் பில்ரோத் ஹாஸ்பிட்டல் எங்களுக்கு ரொம்ப நல்லா கிடைச்சிருந்தது.
We were asked to take up IVF wherein she has given counseling about the entire procedure.
ஒரு மிட் நைட் அண்ட் வெரி ஏர்லி மார்னிங்ஸில் வந்து எங்களுடைய சுச்சுவேஷனுக்கு நாங்கள் டாக்டர் கால் பண்ணும்போது டாக்டர் ரஜினி வாஸ் இன் பொசிஷன் டு ஷி வாஸ் வெரி சப்போர்ட்டிவ் டு மேக் அவர் பர்டிகுலர் கேஸ் பி வெரி சக்ஸஸ்ஃபுல்.
Beta HCG test was done on August 13th. My pregnancy was confirmed. When the scan was done on September 4th again, I was confirmed with twin pregnancy in fact. So that I felt very happy when I conceived.
Dream of having a baby has finally got fulfilled after 11 years of married life.